Hey guys, it's the phenomenal STEMist. Come on and join me. I have Dr. Seanna-kaye Denham Wilks with me. Let me share shortly and we'll get right going. This is going to be an exciting day. The finale of This Is Your Brain on Drugs. And I have a clinical psychologist's perspective. Can't beat that. All right. Hey, it's the phenomenal STEMist. Join me. I am with, hey, Dr. Seanna-kaye, how are you doing?
Hey, Dr. Maya, I'm fine. How are you?
I'm with Dr. Seanna-kaye Denham Wilks. She is a clinical psychologist and wellness advocate. She received her bachelor's degree in psychology from New York University and a PhD in clinical psychology from St. John University. And so all month long, for the past 2 months, we've been talking about mental health. And specifically this June, we've been discussing the role of drugs. And I had to get someone professionally involved in clinical psychology to really get a different perspective at the level of a clinician. So thank you so much, Dr. Wilks, for joining. And I have a couple people watching. Most people watch on the replay. So hopefully this there's been a lot going on with the issues of mental health, and I thought you would be a perfect person to interview to get your perspective. So my first question is, what is your view on or of pharmaceuticals, of the role of pharmaceuticals in mental health?
Okay, so first of all, it's my pleasure to join you, the phenomenal STEMist. Really, really pleased with what you've been able to accomplish professionally and also with this venture. I think that it really breaks down some things that are, that affect so many people in so many ways, but sometimes we really have the inside knowledge behind it. So
right.
Work.
Thank you.
Of pharmaceuticals and their role within mental health treatment, I think that is a topic that's got a wide range, but for the purposes of why pharmaceuticals would be paired with talk therapy or music therapy or any other kind of therapy, I think I want to kind of focus my comments around that. So a lot of times we are dealing with patients who are in a significant amount of crisis. And for us to be able to use therapies that don't involve pharmaceuticals, a lot of times it would not even be value added to the patient if we attempt to do that while they're still dealing with a significant crisis. So if you're not safe enough to receive to engage in the introspection and the reflection and to accept interpretation of what's going on and to really participate in your treatment plan, it makes it very difficult then for us to establish progress. So for example, if someone is significantly depressed or experiencing a particular crisis around a psychotic disorder, then pharmaceuticals can really help to, as a complement to other therapies, if we're able to address the neurological issues that can be benefited by pharmaceutical treatment in order for other therapies to be able to take place. So in other words, if the person is internally preoccupied, if they're hearing voices, if they're seeing things, if they're feeling things other people don't feel, we want to make sure that we address those things so that in the meantime, as the talk therapy is proceeding, it has more and more effect. So that's one of the ways that I would frame it.
I think that you know, with all, you know, that's why I have you here, because with all the the weeks that I've been going over this, I'm like, for the life of me, why are we using these things? And I really don't think of crisis. I don't think of crisis. And a lot of people are in the midst of crisis. And so we can try all kinds of cognitive behavioral therapies all day long, but if they're in the midst of crisis, and they won't be able to even have that process. Yeah. So, okay. That is a valid point.
Many issues with mental health respond very well to therapies, such as cognitive behavioral therapy. They really do. But we have to remember that what's happening in the brain is happening in all over the body as well. When people are impacted by things like depression, where the anhedonia, or just the interest in participating in life, is so present, and they're just unable to do even what they want to do. Painful process of therapy. A lot of times medications, imperfect though many of them are, and with a great consideration, people who are making a choice to use pharmacological therapy as part of their treatment plan, who are agreeing with the psychiatrist that this is an important aspect of their treatment, are doing so with, I think, what many people don't realize, they're having to make decisions about living with side effects, about, deciding that they're willing to go this path, knowing that there may be some other significant impact to their life as a result of the action of the medication, and the we have to it. So it's a big deal to choose to say, I'm going to
take medications.
Pharmacological therapy. Yeah, absolutely. Yeah.
And I think it's important that we not even get to the crisis mode, and that's where we get to the place of mental health counseling that is preventative, right?
Definitely.
Yeah.
Once you are susceptible to certain things, and I think this goes for just healthcare in general, then you really want to make sure that you have put a plan in place to recognize signs, symptoms, triggers, onset of certain things, so that you're able to shorten the course of the crisis. Some crisis is unavoidable. Sometimes there's nothing that you can do to prevent the onset of an episode, but there certainly is a lot once you understand what's happening to you, and you have good partners in terms of your personal care. Then there's a lot that you can do to insulate yourself, shorten or eliminate the more serious effects of certain psychiatric issues.
Yeah. Wow. Thank you guys for joining. I have Lovely Hawk here. I don't know who Lovely Hawk is. I think that's your friend, Seanna-kaye. And Sister Princess Rwanda. We have all kinds of names. Sister Guthrie's online. We're going to ask her question a little later. Some of them have a couple of questions on here. How do you get a person into therapy when they are in deep denial? We'll talk about that shortly. But before we do that, I'll ask this question. What is addiction from a psychological perspective? So I talked about what addiction is from the biological perspective yesterday.
Yeah. So I was looking at my notes. Addiction from the psychologist's point of view sounds a lot like what addiction is from the scientist's point of view. Most psychologists, in terms of their training, are scientist practitioners. So they're very interested in what happens in, especially the neurological pathways. So, addiction is a combination, from the psychologist's point of view, is a combination of factors that result in a chronic disorder. And it is influenced by biological factors, environmental factors, social factors, psychological factors. We know that about half the risk for addiction is genetic. So there's a role that our genes play in the presentation of addiction as well. And then these factors result in brain changes that cause alterations in our neural pathways, especially in our prefrontal cortex and in the limbic system. So that the whole psychologists really focus on the issue of rewards. And, you know, a lot of times in the work that I do, I would tell parents kind of jokingly, but it's true, you know, bribery works. So
bribery works. Okay.
You know, so that there's this connection between rewards and
behavior.
And our behavior, and then what happens in terms of how those rewards and our behaviors in close proximity to each other create neural pathways. So addiction very much has to do with that reward system that kind of bypasses a lot of our conscious choice when it really takes hold and becomes imprinted in our neural pathways, and then it affects choices, behaviors, judgment, memory, motivation, impulse control, all of those things. You know, I have a little one, and he's 9 months old, and he's transitioning from breast milk to foods.
Mm-hmm.
And one of the things that I was counseled about in terms of preparing, and he eats primarily homemade baby food. Now that he has his little pincer grasp, he's also entered the wild world of Cheerios, which he loves. He's fascinated by that. But the majority of the food that he eats is homemade. And, you know, a lot of moms and aunties and grandmas said to me, be careful what you put in baby food. Yeah. Because once he gets a taste of it,
he gonna want it.
For that taste. Mm-hmm. And it's very much so, you know, like the applesauce is just apples, you know, no sugar, no added sugar, because the apples certainly that I choose tend to be sweet and juicy so that he'll have that flavor and understand that taste. But I don't want him to be craving from this young age. So
don't start it. If you don't, what do you say? Don't start none, won't be none, right?
So when it comes to addiction, that's taking the concept that we just talked about in terms of how our tastes and our choices, our preferences form, as taking it to a whole other level, unfortunately a pathological level, where people's motivation for that taste, for that craving, becomes driven by an addictive pathway. And it's great that we're realizing that this is not something that you know, you can just have the person just stop like that. I mean, how many of us are trying to get off sugar ourselves, you know, much less someone who is experiencing addiction to drugs. Some people believe sugar is a drug, but in terms of drugs and activities that lead to that drug-seeking behavior, those neurological pathways are formed, and when they're formed with those biological, social, psychological, environmental factors all at play, it leads to addiction.
Yeah, so it's heavily the same. Like you said, there's a constant craving for something that rewards you. A lot of the times it's unconscious. And I do think sugar is a drug. I remember trying to get off sugar, and I felt sick. I felt like I felt withdrawal. And you know, they if you look at certain pictures of the brain scans, there's a high increase of dopamine when you're eating a certain amount of sugar. So it's the same reward pathway as if you were using cocaine. And so I think I wonder if we would cut sugar cold turkey and I'm talking about out of the ketchup and out of, like, sugar is everywhere. So, but yes, so it's subconscious reward seeking behavior where you leads to craving, and it comes from all kinds of factors, whether it be biology or social. Okay. Interesting. So, what are some signs of addiction?
Okay. So, I think that we think of maybe how it's been sensationalized in the media. So, you know, a lot of times you'll see movies where the person is itching at their skin because they have that physiological, they're going through withdrawal and they're getting that withdrawal sickness, and they won't be able to be still in their body until they get that fix. So we've seen that sensationalized in the media and movies, etc. But there are a lot of people who are functional who don't exhibit those kinds of erratic behaviors right out, who are functionally addicted and who abuse and misuse substances every single day. But they needed to get started in the morning. They needed to function throughout the day. Their drug-seeking behavior leads them to neglect important aspects of their lives, such as, for some drug-seeking behavior, some signs of addiction. Some drugs, you know, replace the desire to eat, whereas others, the impact of it makes people very hungry to eat after that. So, you know, the search for that high leads people to, you know, empty their bank accounts, their children's bank accounts, their retirement accounts, not pay bills, in order to have the funds sufficient to continue to seek that high and to satisfy that craving. So you have physiologically dependent persons who need the drug in order to be well, right? So they're seeking it in order to not feel the withdrawal symptoms. Right. They need to use the drug in order to be well. And then you have people who are psychologically addicted, and then there's also the overlap of both.
Yeah, I was talking about that yesterday about, you know, opioids. A lot of them, if they don't, the withdrawal is crazy with opioids. They feel like they're going to die if they don't have it, you know. And Camille, you know, Camille McKenzie, she went to Linden. I grew up with Seanna-kaye. Yeah, we grew up in New York together. We didn't go to the same church, but Northeastern Conference, shout out. You're still there, man. You're in New York to the bone. You went to New York, NYU. You went to St. John's. You're still in New York.
For real.
Yeah.
Put it down for y'all. Anytime you want to come back.
But yeah, she was talking about you know, having to separate mothers from children. You know, and I was saying, for a mother to do that, it must have a hold of her. You know, moms love their children, and for them to choose drugs over their children, you know how much of a hold that has on them.
Yes, definitely. And we see a lot of manifestations of that, and it could happen to anyone. Yeah. I mean, addiction does not care what you look like, where you come from. It will get a hold of you, and you would be surprised what you would do as a result of addiction in order to maintain. Yeah. So it's that we really want to help people with and help them to overcome, because it can really devastate people individually, in their family life, in their relationships, and professionally as well.
Yeah. Understanding our mental health is important. And I thank you so much for coming on and explaining at least the drug role of mental health. But I have some questions out here. Hey, Nate, thanks for joining. And one is, how do you get a person into therapy when they are in deep denial?
I think that it's great that people more and more are realizing the role for therapy as part of their wellness, for themselves, for their loved ones. You know, I think that everyone should have a therapist and really understand how their thoughts, behaviors, feelings, actions interact in the context of family history, in the context of history of trauma, as you mentioned, in the context of environmental factors and biology, etc. For people who are not interested, not motivated, reject the idea of going into therapy. A lot of times they know that it's going to touch on things that they can't really face in order to function.
Right.
I get through I can't really spend time bringing to the forefront the things that I've been through or I am going through, or else I won't be able to get up and go to this job. And I need to be able to go to work in order to pay my bills. So sometimes the idea of therapy and the reason why people are resistant is not because they don't know they need to go, but because they know their need and they're not ready to walk that path, because therapy is hard work. And then for the people who don't see their need, but it's what they're going through is impacting others around them, or others can see it and are concerned, I think that you really have to try to motivate around things that they do care about. So maybe they don't care to go to therapy because of factors within themselves, but if they can see that going to therapy individually or with the person who's concerned or with others in terms of family or group therapy, if they could see that that would have an impact on something that they treasure, whether it's some relationship that they treasure or some professional pursuit, that if they are able to have some support in this particular area, then it would benefit something else that they're really motivated to take care of, then that sometimes is a way to get people into treatment as well. So but you do have to make sure that you're not browbeating people either. On some level, people have an awareness of things even when you think that they don't. So just encouragement and support and trying to see what it is that they would be motivated to take care of, even if it's not for themselves, can often get people into therapy. And then I always say to people, sometimes the therapy that will be a key in the lock is not talking. Sometimes it's music therapy. Sometimes it's art therapy that can then open the door to moving towards talk therapy, if that even is necessary. So there are all different types of ways to seek healing when it comes to things that have affected us on a psychological level. So,
I love that, Seanna-kaye, because I think a lot of people, like you said, don't want to go through the process because they're afraid of what the revealing of that pain might cause them, right? And they view therapy as sitting on a couch talking to someone that they don't want to talk about. They don't even trust that person with their heart. And there's a lot of stuff that can be done internally, like with music therapy, and I love that. I think that needs to be let out. Like it's more than just talking to a psychologist or a psychiatrist. Wow.
Movement therapy, dance therapy, I've seen it do absolute wonders. The hospital where I work has a really comprehensive creative arts therapy program. And I have definitely become a big fan and cheerleader of all modalities of therapy where I've seen them be effective, because a lot of times you can be reached through a different type of therapy than people are traditionally used to, in a way that's even more effective than the words.
Wow.
Right?
Wow. Yeah.
With you, the movement you can take with you, the art you can take with you, all those I think are powerful manifestations of ways that healing can take place. They have a lovely garden where I work, and they grow vegetables and flowers. And we talk about New Start. They're out in that sunlight.
Yeah.
They're getting that air.
They're exercising, they're moving.
Exactly, and there's a beauty in nurturing something, or watching the cycle of life through just being out in nature and participating in the garden. So there are tons of ways. Our five senses are involved in our psychology. Our five senses are involved in our neurology. Our
That's
five
right.
senses are involved in everything that has happened to you. Trauma that happened where your body was involved, which is just about every kind, your body remembers. So that movement therapy can really
release.
Yeah, exactly. What's being held in the body and deal with it in a way that the talking just can't touch. So there's more than one way to get healing.
Wow, you have taught me something today. There is more than one way. Paul Graham says to say it, girl, say it. There is more than one way of healing. And so don't bog your mind down into what you think it is. Just get healed. Get healed.
And where there is stigma, a lot of times people don't realize that they are engaging in forms of therapy also, especially in faith communities.
Church, we dance, we praise, we sing.
Right? We pray, right? Which is talk, which is putting the content of the issue into words, and by expressing it and by making it transparent, we release some of it in some way. We know that partnering on the clinical side with people's faith community is a great way. If your therapist doesn't want to know all the ways that you have tried to address what is going on, including as it relates to your faith, if you're a believer, then if they haven't brought it up, you bring it up. It's really important that they understand how you attempt to heal and all the forms that it takes, because that's something that can be utilized in therapy as well, if your therapist hopefully is open to your complement, your menu of healing, so to speak. So I think that that's one of the things that is misunderstood about therapy, that how we see it in the media and what it actually entails are often not the same.
They're not the same. And I really believe if more people knew that, I think more people will be open.
And I think that it's just like when you're looking for an internist. For women, the choice of who takes care of their reproductive health is very important. People want someone who is going to be knowledgeable and who is going to deliver the care that they're looking for in a way that gives a great patient experience.
Safe,
definitely. Sometimes the first therapist you try, that's the one. The click is there, the therapeutic alliance is there. The work is difficult, but you have a partner in this thing, and your goals are clear, or the work towards clear goals is proceeding well. Not that there won't be bumps and bruises, because therapy is often 2 steps forward, 10 steps back, and any degree of movement. It's not linear. So there are times when the click is right away, and then there are other times where the therapeutic alliance it's just not going to get you where you need to get to. So it's okay to have gone to a therapist if it's not gelling, and you and the therapist end that therapeutic connection, and you seek someone else. That's okay too.
Because there's different needs, and they might have gotten you to a place, and then you need to get to another level, and another person can get you there, not that person.
Exactly.
Yeah.
And then the type of therapy that the therapist uses is very important as well. I'm a cognitive behavioral therapist with a strong component of family systems theory as well. In other words, we're going to talk about the thoughts, behaviors, and the feelings, but we're also going to talk about the context in which they developed in terms of your role in your family and cultural factors, etc. That's how I work.
I love that, by the way. I think that's, big. But go ahead.
that doesn't work for everybody.
Mm-hmm.
You know, so and also it doesn't work for every psychological issue.
Mm-hmm.
So that's the thing that I think people need to research also. I'm having issues with hearing things other people don't hear, seeing things other people don't see. That means that I need someone who has done work with that kind of psychological issue and is able to use effective methods, right? Mm-hmm. So if that is not in the sphere of your pastoral counselor, that may probably be in the sphere of your local psychiatrist, you know, to kind of bring it full circle in terms of pharmaceutical therapies. So I think that's important, that people understand that you have to do your research in terms of the kind of therapy that would be most effective for the situation that you're dealing with.
And sometimes it may involve pharmaceuticals, and we have to be open to that. But definitely everything can't be given to the pastor, guys. And also, of which many of them aren't trained in psychology at all, right?
They have general knowledge. Mm-hmm. Some even seek additional knowledge. But I certainly would not want to step into a pastoral role as a psychologist because I don't have that training. And I think that more and more clergy are partnering with therapists to have that person as a referral source and vice versa, to really help their parishioners to have what they need in order to be well. I say if it's going to help you and it's going to heal you, do that.
Amen. That's right.
So really my perspective.
Yeah. Thank you so much, Dr. Seanna-kaye Denham Wilks. I am so happy that you took this opportunity to explain the role of psychologists and clinical psychology in mental health, and some necessary role of pharmaceuticals. Thank you guys so much for joining. I am the phenomenal STEMist. And yeah, so is she. Good night, all. Thank you so much, Seanna-kaye.
Pleasure, Mom.
Yeah.
Invite me back anytime.
Absolutely. Next time I do something with mental health, you'll be back. Thank you.
Thank you. Good night.